Well, let's get more on this now with Dr. Angelique Coetzee, board member and former chairperson of the South Africa Medical Association. She joins us now from Pretoria. Welcome back to the program, Doctor. Could you start by giving us an idea of how prevalent diabetes is in South Africa, where you are?
Good morning. Diabetes is very prevalent in South Africa. We have a high burden of diabetes. And a lot of our diabetes patients is currently type 2 diabetes. And we all know that most of the times your type 2 diabetes will, within about between 5 to 10 years, proceed to use insulin to help them, with producing lower levels of glucose. And your tablets are not always the only answer. And people think that if you're having diabetes type 2, you only need tablets. We need to relook at the definition as well, as the definition says that only type 1 will be insulin dependent, but it's actually type 2 as well. And if we look at the cost of insulin, insulin has been developed in 1921, and we would think that by now, nearly 100 years later, it would be extremely cheap. But it's high prices. And 80% of your patients living with diabetes are in low and middle income countries. And most of them can't afford these high prices, then default on their treatment. In South Africa, especially this past 2 years with the COVID-19, we have seen an increase in cardiac risks, diseases, strokes, blindness, as well as chronic kidney disease. That is actually on the rise.
That's right. Now, Doctor, can I interrupt you there? Sorry, because as you say, insulin prices are sky high in some countries, high enough that Human Rights Watch, as we saw there, is declaring that it contributes to human rights abuse, which sounds like an extreme assessment. But do you agree with their view there?
Yes, I think we can all agree that diabetes is a pandemic. And if it's a pandemic, even if it's an endemic disease, it's not being treated with the same vigor than COVID-19 has been treated. And although more people are affected by diabetes, and yes, we are not coming to the party. There's a lot of inequality, especially in your middle and poorer income countries. And it's not only the insulin. So if you give insulin to a patient, you need to monitor the patient. So a lot of times the devices will be given for free, but the test strips are extremely costly. So you end up with a patient that is cutting down on his daily insulin, also not testing. And it's a huge problem. With chronic diseases, with the complications, we cannot afford it.
As you say, it's often the lower income countries who are hardest hit by rising insulin prices. So where should the responsibility lie in terms of helping give these countries more access to insulin? Is it the drug companies' responsibility, or do governments around the world need to help those in poorer countries to subsidize these treatments?
So it should be a multidisciplinary approach. Your drug companies needs to bring down the prices. There should be more biosimilar insulin on the market that is affordable. How can insulin become more expensive? There was a study done with the WHO where they said that in about 15 years ago, a vial of insulin called Humalog cost about $59 per vial. Now in 2018, that same vial of insulin costs around about $3,000. So how did we manage to get there? It's supposed to get cheaper, especially there's a huge demand. We need to bring down the prices. Governance must make it more affordable. It should be on the drug lists. You should have a bigger variety of insulin available to suit the patient's specific requirements, and testing should be right. So it is on governmental level. It is on the level where you have your formularies at your hospitals and at your medical schemes or your service providers, as well as the pharmaceutical companies.
Okay, Dr. Angelique Coetzee, we will have to leave it there, but thanks very much for joining us here on TRT World.
Thank you.